Pericarditis. 1. Pathophysiology. Pericarditis is the inflammation of the pericardium, the thin, double-layered sac surrounding the heart. The pericardium has an inner and outer layer with a small amount of lubricating fluid between them, which helps reduce friction as the heart beats. When the pericardium becomes inflamed, it can cause sharp chest pain and other symptoms. Pericarditis can be acute, sudden, and short-term or chronic, long-lasting. In severe cases, it may lead to complications such as cardiac tamponade or chronic constrictive pericarditis. 2. Onset and duration. 3. Prevalence. 4. Prognosis. 5. Signs and symptoms. Sharp chest pain. Pain radiating to the shoulder, neck, or back. Shortness of breath. Pericardial friction rub. Fever. Fatigue and weakness. Swelling. Palpitations. 6. Complications. Pericardial effusion, cardiac tamponade. Constrictive pericarditis. Recurrent pericarditis. 7. Causes. Pericarditis can have many different causes, and often, the exact cause is not identified. Idiopathic pericarditis. Common causes include viral infections, bacterial infections, fungal infections, autoimmune diseases. Post-cardiac injury syndrome. Trauma or injury. Cancer. Kidney failure. Medications. 8. Tests and diagnosis. Diagnosing pericarditis requires a thorough clinical evaluation along with imaging studies and laboratory tests. Diagnostic tools include electrocardiogram (ECG), echocardiogram, chest X-ray, cardiac MRI or CT scan. Blood tests, cardiac enzymes, inflammatory markers, viral or bacterial cultures, autoimmune tests. 9. Treatment and medications. Treatment for pericarditis focuses on reducing inflammation, relieving symptoms, and addressing the underlying cause. About lifestyle changes. Rest. Dietary modifications. About medications. Nonsteroidal anti-inflammatory drugs, NSAIDs. Colchicine. Corticosteroids. Antibiotics or antifungal medications. Diuretics. About interventional/surgical treatments. Pericardiocentesis. Pericardiectomy. 10. Nursing points. Monitor vital signs. Pain management. Assess for pericardial effusion. Educate patients. Prevent recurrent episodes.